Pennsylvania Senator John Fetterman checked himself into Walter Reed National Military Medical Center to receive treatment for clinical depression. A statement from his office Thursday said, quote, "While John has experienced depression off and on throughout his life, it only became severe in recent weeks." It goes on to say, after examining John, the doctors at Walter Reed told us that John is getting the care he needs and will soon be back to himself. The 53-year-old freshman Democrat suffered a stroke last May while running for the Senate and had surgery to implant a pacemaker. He was elected to the Senate in November, flipping a key seat that was crucial to Democrats maintaining their majority. Dr. Rebecca Brendel joins me now. She's the president of the American Psychiatric Association. Doctor, Senator Fetterman had a stroke during the campaign, as we mentioned. Is there a correlation between depression and having had a stroke?
Well, while I can't comment specifically about Senator Fetterman or anyone else's condition, as I haven't examined him, we do know that one of the things that can happen after someone has a stroke is that there can be changes in mood and other mental health symptoms.
And underscoring what you just said, which is every case is different and we don't know the particularities other than the senator's previous history that his office referred to. With those enormous caveats, what does treatment look like in a case that has these rough outlines?
Well, it can depend, of course, on the specific symptoms and the specific person. But generally, the most important thing to know is that depression is a treatable condition and generally involves a combination of medications and psychotherapy, talk therapies, and may include treating other underlying medical conditions as well.
And Doctor, that phrasing, "he will be back to himself," it's a colloquial phrase, of course, but when one is living with depression, that is who you are. Is there a way that we should be thinking about? I mean, it's a treatable condition. There are many people who, in fact, give us a sense of how many people are treated for depression or experience depression. And I guess the point is it is a part of who they are, not a distinct thing.
Well, it's a complex interplay because it's so personal. How we think, how we feel, how we act is so much a part of who we are. But we do know that depression is quite common. The CDC estimated that as many as 8% of Americans suffered from depression in 2020. And we know that people can tell the difference when they're no longer depressed, that something was off, or they really were having symptoms of their mood being down, not being able to sleep, lacking interest and energy, even changes in appetite or thinking about oneself and one's future.
And is that pretty much the list? If somebody, what is there anything else people should look for if they're worried about depression, and what should they do if they are concerned?
Well, people are sometimes concerned that they feel down or sad or something's happened in their lives, that they're depressed. And really what depression involves is at least a 2-week period of most of the days or all the days having changes in one's mood, changes in one's interest, not enjoying things that one would usually enjoy, as well as physical symptoms of changes in appetite and sleep and energy. And finally, in its most severe forms, even thinking about not having a future or wishing that one were no longer alive or wanted to be dead.
All right, Dr. Rebecca Brendel, thank you so much for being with us.
Thank you.